Hello guys, good day. This is Anne of Reinforce Big Love, your fellow positive reinforcer. Today we are going to talk about Nursing as an Art by Florence Nightingale. You know the way, before completing the degree, nursing degree, it's a degree in the Philippines, and gaining years and years of experience, all I know about nursing is taking good care of sick people, assisting people on emergency situations such as sports injuries, road and traffic accidents, calamities, epidemics. Nurses are always there in the picture. Above all, I took up nursing because basically before, when I was young, I have no idea what I'm going to do. So my dad gave me an option to take up nursing, because other than the fact that it's a decent job, it will give me an opportunity to go abroad and explore the world. So yeah, I took up nursing. I finished it, and in the first 3 years, I still hardly making my own nursing arts, because I've when you are a nurse, you have to master the soft skills, the art of nursing. Soft skills involve caring, compassion, good communication, empathy, kindness, understanding. Plus, a nurse has to be a patient advocate. Other than knowing the routines in the medical surgical area, general ward, neurosurgery, delivery room, NICU, emergency room. Other than knowing the routines in your area of assignment, in the most part, a nurse has to to provide and manifest as well as practice the soft skills to be able for a nurse to distinguish, to get, or to really find out what are the needs of her patients. Now, it's actually a hardcore profession. It ain't easy. But when you know exactly, even just the soft skills, your character, your attitude, even just simply possessing a good attitude alone, a nurse can go far having a good attitude. You know what? You know why? It's because having a good attitude, a nurse can able to distinguish the needs of the patient. A nurse can be cooperative to the doctors, to her colleagues, and in that way, a nurse can learn from the patient, from herself, from her colleagues, and that will help the nurse grow and get better in time. I started to be honest, I only happened to understand nursing after 5 to 10 years of experience. It came to a point that having that length of experience, when I go to work, I don't really need to think much, because everything became automatic. Most of the skills I've already possessed became habits. I've already mastered the routine, but not all. There are some unexpected happenings that takes place. But most of the time, when you're working for years and years, it's like you've memorized the routines. You've memorized what's going on, and every time the unanticipated stuff comes along, pops up, and it's another knowledge for you. So by the time when the nursing skills have already ingrained in me, but not perfectly ingrained. it's already established, not perfectly established, I became more intentional. Intentional in expressing care, empathy, and creativity in meeting the physical and emotional needs of my patients. And then I realized that that is the art of nursing. Although I've been practicing that for years and years, I just appreciate the beauty of it after practicing it for like over 5 years. That I can able to get what I need, what data I need from the patient so that I can apply the scientific part of nursing. I have to make a thorough assessment, subjective, objective, and then I can come up with a diagnosis other than from the doctor's diagnosis, and then do my intervention, which is also medical and evidence based, scientific based. Uh, it's backed by science. So overall, you know, if if you cannot apply the art of nursing, if you're just relying on what doctor says, what what should be done, giving medicines, just being in the surface of caring, that you don't really extend your hand to care for a patient, you wouldn't be such an effective nurse. Nursing is also, other than hard work and passion, it's also a channel for personal development for nurses. To be able for us to get to know the patients, the other people, the colleagues, collaborate with other healthcare providers, we also need to be self-aware and grow as ourselves. So that, we are the first, we are the first line, how'd you call that? First line of staff who's always been there with the patient all the time. I'd said all the time. Like if we have 12 hours, we're going to be with our patients for 12 hours. So if we don't use the art of nursing, being caring, if empathetic, loving, understanding, looking at the patients holistically, giving individualized needs because people are different, the science base wouldn't be effective if we ourselves, nurses, won't be able to use our artistic way, our very own, artistic way as a nurse. And that is the soft skills. I love nursing because it helped me understand people and develop the soft skills, which I'd say make every person human. And by merely understanding people, I can able to distinguish, or I can able to recognize their needs and give it to them, which makes the treatment or interventions, medical interventions, successful. And that's actually the main thing. And even after the recovery of the patients in the hospital, another good thing about healthcare system is the continuity of care. That is, when the patient is discharged, continuity of care, follow-ups, which is also can be done by a nurse. It could be community nurse, nurses working in social workers, with social workers. So it's actually continuous, holistic, and individualized nursing as an art. Compassionate, understanding, empathy. These are the things that I never thought I could possess. but not perfectly, because I'm not a perfect person. I'm not a perfect nurse too. But, medical treatment wouldn't be effective without possessing the soft skills. That is the art of nursing. And yes, after working for years and years, I learned to love nursing. Other than, you know, the financial aspects of it, mainly I learned to love my job because it helped me grow. It helped me realize the beauty of life by merely seeing other people's by merely helping other people's happiness, you know helping other people fulfill their needs, their wants, their requests, even small things. Anyway, it all starts from small things, by just smiling, and then you can introduce yourself, and then you can talk, and you can then figure out what your patient needs, and then give it to them. They say thank you, they smile, and over time, even a gentle pat on the shoulder can push them to help themselves recover. And that is the art of nursing, plus the medical intervention. But overall, without the art of nursing, without the soft skills, science would be just like a kind of the AI part of the intervention. So humans need human touch. So patients needs the art of nursing, and nurses must possess their very own creativity in expressing the art of nursing in their own way. So I hope this episode, can give you a little bit of an idea about nursing. And I'm just sharing these thoughts today because we're going into 2025, and it's a new beginning of the year. So it's time to rethink about our goals and aspirations. What needs to be done? What are the things that we need to continue? What are the things that we stop doing? So in terms of our profession, yes, it's also an opportunity for me to let you know the importance of the soft skills. So Happy New Year. I hope you have a great time today. By the way, this is Anne of Reinforcement Club, your fellow positive reinforcer. If you ever love this episode today, you can share this to your family and friends. You can follow me in YouTube, Facebook, Spotify, Apple Podcast, even in Amazon Podcast. Reinforcement Club, I do appreciate your time, and have a lovely day ahead. Thank you very much. Happy New Year.